We know winter brings greater pressure on our emergency care services, and this year we have the added challenge of a likely resurgence in COVID-19 cases. Our winter plan aims to ensure we provide safe, timely emergency care over the winter period. Our Trust Board approved our winter plan in public session and the commitment of £4.7 million of revenue funding to support its implementation. This is in addition to £4.1 million of capital funding received from national allocations. Our winter plan has three key strategies to it. Firstly, to put in place interventions that will help patients get seen, assessed, diagnosed and treated more quickly. As a consequence, we want to avoid overnight hospital admission wherever appropriate. And for those patients who do need to stay, we want to help them to get better sooner and to be safely discharged at the earliest opportunity. Secondly, to run the festive period as close to normal working day arrangements as possible, so that as many of our patients as possible are safely treated and discharged over Christmas and New Year. We know this will reduce the pressure in early January and was a key success from last year's winter plan. And finally, to maximise the benefit of the £4.1 million capital investment that we've secured to improve segregated COVID-19 pathways within the hospital.
We will deploy an intermediate care manager and additional discharge coordinators at the weekend to facilitate safe progress of discharges to intermediate care. We will deploy increased palliative care specialist nursing to facilitate domiciliary end-of-life care.
We will strengthen inpatient therapies cover to ensure patients progress with their rehabilitation. We will deploy a care home support team to keep residents safe and well and prevent avoidable hospital admissions.
We will increase continuing healthcare assessment capacity to prevent delays. We will provide post-discharge MDT follow-up of patients who have had COVID-19.
We will expand our waiting room space to maintain social distancing between patients. We will expand our cubicle space to prevent overcrowding. We will deploy additional consultants, middle grades and advanced care practitioners, as well as junior doctor shifts in ED. We will extend the rapid assessment of ambulances to 2 a.m. so that we can release ambulance crews as quickly as possible to enable them to get back on the road for the next 999 call.
We will deploy phlebotomists in ED to enable quicker blood tests and therefore earlier clinical decisions. We will extend progress tracer cover to support our nursing and medical teams. We will deploy a transfer team to speed up transfers between ED and assessment units.
We will convert Route 142 into our new frailty and integrated front door service, releasing Ward 14. We will extend the hours of our frailty and integrated front door service and run it from the unit 7 days per week. We will deploy consultant positions in ED, 1700 to 2100 on weekdays and 1400 to 2200 on weekends to provide rapid senior assessment and prevent avoidable admissions.
We will extend AEC opening hours until 10, 7 days a week to maximise safe ambulatory emergency care. Rather than inpatient admissions, we will open 6 additional medical beds on Ward 4, taking the ward up to 34 patients. We will open 28 additional medical beds on Ward 14. We will deploy 3 junior doctors across the modular wards and 4 junior doctors across the West Wing wards on Saturdays to maximise the effectiveness of consultant ward rounds. We will deploy an additional junior doctor on Sundays to support the completion of EDSs and clerking.
We will deploy our surgical ambulatory care unit 24 hours, 7 days a week on Ward 22.
We will increase our critical care capacity up to 18 level 3 patients if required.
We will have a dedicated nursing flow manager. We will run additional CPOD and trauma theatre capacity, so no non-elective surgical patients have delayed operations.
We will open Ward 10 to provide additional surgical inpatient capacity.
We will run urology hot clinics twice weekly and daily general surgery hot clinics to support timely access to senior medical decision making.
Supporting the avoidance of ED attendance.
We will deploy an additional registered nurse and doctors in paediatrics to support timely flow through PAU.
We will run separate elective children's surgery on Ward 26 to maximise non-elective ward capacity on Ward 21.
We will deploy additional CT, ultrasound and plain film capacity at weekends to ensure all patients receive their scan within a maximum of 24 hours from request.
We will deploy additional pharmacists to optimise patient care.
We aim to run the festive period from Saturday 19th December to Sunday 10th of January, as close to normal working day cover along acute pathways as possible, including 7 days a week consultant ward rounds on all of our medical wards over the festive period. We will have a consultant orthogeriatrician ward round on weekends and the bank holidays over the festive period. On-site pharmacy service until 7 o'clock at night and at weekends and the bank holidays. Prompt access to inpatient radiology with additional CT, MRI and ultrasound lists at the weekends and the bank holidays.
Community will deploy more therapists, discharge facilitators, social workers and intermediate care workers at weekends and over the bank holidays throughout the festive period.
And there'll be a second site practitioner on the weekend supporting the operational ops centre. Operational managers will be on site as well at the weekends and bank holiday, in addition to the on-call management team over this period.
Despite all these interventions, we know some days are likely to be highly pressurised. We commit to look out for each other and to look after each other so that in turn we can best look after our patients. Thank you to all our staff and our partner organisations for all your hard work to deliver safe, timely emergency care this winter.